What if we told you that schizophrenia, a complex psychiatric disorder, affects more than 20 million people worldwide, and that a significant portion of them struggle with debilitating negative symptoms? Schizophrenia, a term that may sound familiar, is a mental disorder that affects countless lives globally. It's a complex ailment, characterized by a blend of symptoms that can severely impact an individual's daily life. Imagine trying to navigate your daily routine while battling with persistent hallucinations, delusions, disorganized speech, or even disorganized behavior. That's the reality for many people living with schizophrenia. But beyond these symptoms, often referred to as positive symptoms, there's another side to schizophrenia that is equally, if not more, debilitating. These are the negative symptoms, which include deficits in affect, speech, motivation, and sociality. Negative symptoms often manifest as emotional flatness or lack of expressivity, reduced speech output, a decreased ability to initiate and persist in goal-directed behavior, and a diminished capacity for social interactions. These symptoms can be subtle, yet they profoundly impact the person's ability to function in daily life, significantly more than the positive symptoms. Now, here's where things get even more challenging. There are currently no Food and Drug Administration, FDA, approved treatments specifically for these negative symptoms. That's right. While there are medications to manage the positive symptoms, the negative symptoms often remain untreated, leaving many individuals with schizophrenia struggling to lead a fulfilling life. The economic burden of schizophrenia is also staggering. In the United States alone, the cost is estimated to be over $60 billion per year. And let's not forget the human cost. The impact on quality of life for the individuals affected and their families is immeasurable. Now that we've set the stage, let's delve into the history of schizophrenia and its symptoms. Understanding schizophrenia and its symptoms requires a journey back in time to when this disorder was first recognized. The term schizophrenia was first coined in the early 20th century by Swiss psychiatrist Eugen Bleuler, who recognized it as a separate mental illness. He believed that the disorder was not a type of dementia, as was previously thought, but rather a condition that could affect individuals at any age. Over the past century, our understanding of schizophrenia has evolved dramatically. We've come to understand that the disorder is characterized by a wide range of symptoms, which can be broadly categorized as positive and negative. Positive symptoms refer to those that most individuals do not usually experience, but are present in people with schizophrenia. These include hallucinations, delusions, and exaggerated or distorted perceptions, thoughts, or emotions. On the other hand, negative symptoms refer to the absence of normal behaviors or feelings that are present in healthy individuals, but absent in those with schizophrenia. Examples include deficits in affect, speech, motivation, and sociality. As our understanding of these symptoms grew, so did the need for tools to accurately measure them. In the mid-20th century, researchers developed assessment tools like the Positive and Negative Syndrome Scale and the Scale for the Assessment of Negative Symptoms. These scales allowed for a more objective and quantifiable way to assess the severity of schizophrenia symptoms. With this historical perspective, we can see how our understanding of schizophrenia and its symptoms has evolved over time. But what if there was a new treatment on the horizon? Imagine a drug, commonly associated with rave culture, potentially revolutionizing the treatment of schizophrenia's negative symptoms. This drug is 3,4-methylene-dioxymethamphetamine, more commonly known as MDMA. MDMA, often misconstrued as a party drug, is being re-evaluated in the scientific community for its therapeutic potential. In recent years, MDMA has been explored as a treatment for post-traumatic stress disorder, or PTSD, with promising results. Through clinical trials, it has shown potential in reducing symptoms of PTSD, paving the way for further research into its medicinal properties. These studies have shifted the perception of MDMA from a recreational drug to a potential therapeutic agent. But the potential of MDMA goes even beyond PTSD. It's now being considered for treating negative symptoms of schizophrenia, which include deficits in affect, speech, motivation, and sociality. These symptoms can severely limit daily functioning, and currently, there are no FDA-approved treatments for them. Approximately 60% of patients with schizophrenia exhibit these negative symptoms, which are often resistant to conventional treatment methods. MDMA has unique properties that, theoretically, could counter these symptoms. Its ability to enhance social interactions and generate empathy could help address the sociality and affect deficits that are characteristic of schizophrenia's negative symptoms. Furthermore, MDMA's potential to induce metaplasticity in the brain could lead to long-term improvements in the cognitive functioning of patients. The concept of MDMA as a treatment for schizophrenia's negative symptoms may seem radical, but the evidence supporting its potential is growing. As with any potential treatment, further research is required to fully understand its efficacy and safety. But the possibility of MDMA contributing to a breakthrough in schizophrenia treatment is an exciting prospect that's opening up new avenues in psychiatric medicine. As with any potential treatment, the safety and efficacy of MDMA for negative symptoms of schizophrenia must be thoroughly evaluated. Let's dive into the compelling evidence that supports the safe and potentially effective use of MDMA for treating negative symptoms of schizophrenia. A series of studies have highlighted MDMA's ability to enhance social interactions, generate empathy, and induce metaplasticity in the brain. These properties seem to align perfectly with the deficits observed in schizophrenia patients, making MDMA a promising candidate for treatment. Now, it's crucial to remember that safety is paramount when it comes to any form of treatment. With MDMA, there are several safety considerations to bear in mind. Like all substances, MDMA carries a risk of misuse and dependency. Therefore, it's essential that any therapeutic use of this substance is carefully monitored by medical professionals. Additionally, MDMA's side effects, which can include increased heart rate, high blood pressure, and in rare cases hypothermia, must be closely monitored. It's also worth noting that the long-term effects of MDMA on the brain are still not fully understood, and further research is required in this area. But how does MDMA work? The possible mechanisms of action of MDMA are multifaceted and complex. It increases the release and slows the reuptake of serotonin, dopamine, and norepinephrine in the brain. This leads to an elevated mood and heightened emotional responsiveness, which can potentially counteract the negative symptoms of schizophrenia. Considering these factors, it is clear that while MDMA may hold potential as a treatment for the negative symptoms of schizophrenia, it is not without its risks. It's a balancing act, weighing the potential benefits against the possible risks. While further research is needed, the potential of MDMA to treat the negative symptoms of schizophrenia is undeniably promising. From the history of schizophrenia to the potential of MDMA as a treatment, we've journeyed through a complex landscape of mental illness and therapeutic innovation. We've delved deep into the enigma that is schizophrenia, a complex psychiatric syndrome characterized by psychosis, and the burden it places on those who live with it. Recognizing that the negative symptoms, such as deficits in affect, speech, motivation, and sociality, severely limit daily functioning and are present in approximately 60% of patients. We've acknowledged the dire need for effective treatments. We've traced back the history, understanding the evolution of terms positive and negative symptoms, and the development of tools to measure these symptoms. We've specifically examined blunted affect and alogia as manifestations of these negative symptoms, associated with reduced emotional expressivity and deficits in verbal fluency, respectively. Our journey then led us to a potential beacon of hope: 3,4-methylene-deoxymethamphetamine, or MDMA. We've explored how this substance, known for its ability to enhance social interactions, generate empathy, and induce metaplasticity in the brain, could be a novel therapeutic. Already being explored as a treatment for PTSD, its potential to target negative symptoms in schizophrenia seems promising. Of course, we haven't shied away from the crucial safety considerations. We've taken a hard look at the evidence supporting the safe use of MDMA and the possible mechanisms of action. It's clear that while the potential is exciting, responsible use and continued research are paramount. As we draw this journey to a close, we emphasize again the potential of MDMA as a treatment for the negative symptoms of schizophrenia. It's a potential that demands attention, that calls for continued research and exploration of innovative treatments. It's a potential that, while not a definitive solution, offers a glimmer of hope in the complex and often daunting landscape of schizophrenia. As we continue to unravel the mysteries of schizophrenia, the potential of MDMA and other novel therapies offers a beacon of hope for those affected by this complex disorder.